All right. So, so Patrick, I just want to make sure that I have everything that I need to completely understand what's going on with your situation. That way, I can better help you for our treatment plan and things like that. Um, so currently, you've got some right leg pain going on. This is something that's really come on about a month ago, um, and it's got some radiation going down the side of your leg, back of your leg, and into the side of your foot as well, starting at the top of the hip. So this is something also that you're concerned about because it's affecting your daily habits like walking and working out with your trainer. Um, but it's also causing you some fear that this might mean that you'll need surgery because you've got some other degenerative problems that you've had before this, um, which I totally understand. I totally get. I hear you, and that's definitely something that we can talk about. Um, this right leg pain is something that's new to you. Hasn't been getting any better, um, but you've had low back pain in the past. But those previous low back pain bouts were for about 2 or 3 days, and they went away. They never were anything to worry about in your case, in your words. So you've also, like I previously said, you've been diagnosed with cervical stenosis, so it's more degenerative changes like we discussed earlier. But you've been working out with your trainer, which seems to have really helped. So that's awesome. That's great. Seems like your trainer knows what he's talking about, or at least is doing a great job with you. Um, but things like walking for longer than 5-10 minutes, or standing for longer than 20, 30 minutes, reverse lunge, cobra position, lumbar ranges of motion, and in all directions are all difficult movement patterns for you as well. I can see that. Based off of the exam findings and with your current situation, I believe what could be causing your right leg pain is actually from your lumbar spine and lumbar stenosis. Given your cervical stenosis history and the history that you presented with me today, the known degenerative changes and stenosis in your imaging of the low back, coupled with the leg pain that's come on, and it's been giving you some radiating pain and everything that's going on. I believe that this is what we're dealing with. So I know that you've got a lot going on right now, and that's giving you some added stress to your pain. But I wanted to give you some recommendations that I think could help with the pain. So our pain levels can be sometimes increased due to our emotional state or stress levels, and I want you to know that I hear you and I completely understand where you're coming from, and that you're not alone in this. So I know that you're worried about needing surgery, but there are other things that we can do to help actually to keep from getting to that point um, by slowing down the progression just a little bit. Um, I think that working with your trainer, who's helped you with your previous cervical stenosis pain, is going to be a key factor in this and in your health. He obviously knows what he's doing. He obviously knows what he's talking about, and you already have a great trusting relationship with him. So I would recommend continuing exercise with him and focus more on the low back now. Um, Obviously, don't get away from the cervical pain because we want to keep that where it's at and keep it from preventing you from doing other things. But we need to focus more on the low back now because the low back is more the issue now. So, um, and also keep exercising. Exercise is a great way to relieve stress. It's something that I highly recommend that you continue doing. Another thing that I'd like to recommend are exercises. These exercises are meant to help uh, hold chiropractic adjustment because I do believe that chiropractic is right up your alley. I believe that chiropractic care can definitely help you along with your trainer. Um, but these are meant to hold the adjustment longer and also strengthen some areas that may be weakened or anything like that. So the first thing is actually what's called nerve flossing. So what I'm going to have you do is you're going to be seated in a chair, and what you're going to do is that right leg, we're going to extend that right leg out, point our toe up in this seated position, and we're going to lean forward. And as we're leaning forward, we're going to point our toe towards the front. So our toe is pointed up right now, and we're going to point our toe. We're going to push into the floor. Okay, so we're going to lean forward, point the toe, and bring it all back up, all in one motion. Now, what this is going to do is it's meant to free up the nerves and spinal cord from impingement that's going on. This gliding and stretching of the nerves is going to help reduce some inflammation that could be going on or compression that might be caused by the degenerative changes that are going on. So it'll help with the pain a little bit. The next exercise that I recommend doing is a knee to chest exercise. So what you're going to do is you're going to lay on your back, and this is going to not only stretch the low back musculature, but it's also going to relieve some of the pressure that could be built up around those nerves. So what we're going to do, again, we're going to lay on our back. We're going to bring our knees to our chest, and we're just going to pull our knees to our chest. We're going to do those for sets and breaks. But other than that, I think you're in great hands here. I believe we've got something going on that we can definitely help you with, and I'm looking forward to it.